And now to Borno State, where the Commissioner for Health and Human Services, Mallam Babagana, says about 16,000 tuberculosis patients in the state are reported not to be receiving treatment, putting the state at risk of the spread of the disease. He disclosed this while speaking to newsmen in Maiduguri, the state capital. TVC News' Jesse Tafida reports.
The rising cases of tuberculosis in Borno State has been of great concern to government and humanitarian agencies. And today, the State Commissioner for Health and Human Services is set to brief the press on the risk factors of the disease.
Nobody should die of tuberculosis.
He disclosed that about 16,000 patients of TB cases in the state have not availed themselves for treatment, a situation that is deeply troubling.
The Ministry of Health, in collaboration with partners such as WHO, such as Global Fund, such as INI, such as UNICEF, we are working together assiduously to ensure that TB issues are well focused and well treated and well diagnosed throughout the state. With the huge investment in TB program, the ministry will continue to monitor the performance of state TB program.
Stakeholders at the meeting revealed that the huge gap of treatment poses a great risk of further infections within community members.
Despite significant strides in medical science and public health, TB remains a formidable global health threat, particularly in the vulnerable and marginalized populations. TB is present in all countries and it affects all age groups. Let us honor the memory of those we have lost to this disease by working tirelessly to create a world where no one suffers from TB.
With the allocation of 15% of the state budget to healthcare, stakeholders believe that it will greatly improve the standard of healthcare delivery in the state. The Borno State Ministry of Health and Human Services has assured to work with partners towards finding a lasting solution to the problem of tuberculosis in the state. It also announced the appointment of a new program manager of tuberculosis with a mandate of improving treatment coverage in the state. Jesse Tafida, TVC News, Maiduguri.
And Jesse joins me live for more from Maiduguri. The number of untreated tuberculosis cases is alarming. Tell us more about what government is doing.
Thank you very much, Nifemi. It is good to note that people of Borno are in the vulnerable states because, you know, we have IDPs living in the state and the outskirts of the state. And people live in a very great number in IDP camps, which is very much of concern to the government. And 16,000 is alarming. After the Commissioner of Health disclosed this generated a lot of concerns among residents because everyone is now at risk. But he said about 5,000 cases have been treated last year, which is also a green flag. It also notes that there is need for more awareness to traditional leaders, religious leaders, to tell the people about the risk factor of this disease, the symptoms, what people should do. And some residents are saying, how much are they going to pay to access treatment of this? And the Commissioner of Health has cleared the air saying treatment is free in Borno State. The WHO, MSF and other humanitarian partners are supporting the government with drugs and other technical support, which is also a green flag. Now the state government says it is doing a lot, and we could see that they've trained about 60 people who are going to be controlling and monitoring these diseases across the 27 local government areas of the state. We know that the state is relatively peaceful, and most IDPs are back to their places of abode. So now these 60 technical trainees are going down to the 27 local government areas to monitor these cases, to report these cases, so that the number will be brought to the barest minimum. Not only the Borno State government, but also, as I mentioned, the WHO, the MSF, and other humanitarian partners are into this to see that this number is being reduced to the barest minimum. And according to the Borno State Commissioner of Health, people should not be frightened because they are on top of the situations. And if cases is being reported on time, it will be treated. And we have seen survivors of this cases of tuberculosis. They are now survivors. They are ambassadors of tuberculosis, and they are advocating that if you see symptoms, don't go to a chemist or a pharmacy. Go to the hospital so that you'll be diagnosed, and then the drugs are free of charge.
Hopefully, the free treatment will also encourage the patients to, come out for treatment. Thank you, Jesse, for the update there.